Welcome back, everybody, from your break. We're now going to have the Advocacy and Policy Committee do a report out for this very important plenary session. I would just like to say a point of pride for the Advocacy and Policy Committee. Under the leadership of Luvia Quinones, our IAFCC board member, and the active membership and the active members of our Advocacy and Policy Committee, two of which you'll hear with the report out, Lolita and Levi. This committee has really progressed in their involvement and engagement in state level policies for the Illinois Association of Free and Charitable Clinics. If we just take a look back in conference number 7, our 7th annual conference, we had a large report out about just increasing the awareness of our clinics. And then the next conference, we had a work group, or we had a session before the conference that said, do we want an advocacy and policy committee, and kind of engage in the work? And there was an overwhelming yes. And those of you that joined, so appreciate that. And then in the last session, we had a high level overview of the Advocacy and Policy Committee at our annual conference. Today, the content that is going to be presented and shared with you is really due to the dedication and the work of our Advocacy and Policy Committee, and again, under the leadership of Luvia Quinones, along with those of you that are on the call that are members of our Advocacy and Policy Committee, and reported from 2 of our more active members of our Advocacy and Policy Committee. So I'd like to turn it over to Luvia to get our presentation started. And thank you again for all you do for IAFCC, Luvia.
Thank you, Melissa, for the warm introduction. Good afternoon, everyone. As Melissa said, my name is Luvia Quinones. I'm a proud board member of IAFCC and also the co-chair of the Advocacy and Policy Committee. We have some exciting updates on what we have been working on as a committee these last few months. And also for those of you that are maybe hearing about our committee for the first time, we definitely invite you to reach out as well as get involved. Next slide. Some of the speakers that you're going to be hearing from today include one of our committee members, Levi Moore, as well as Dr. Lolita Darba, both very active members of our committee. I believe Lolita has been involved from our first day that we went to Springfield a few years ago, as well as from Levi, who has been sharing a lot of his expertise when it comes to Springfield, both politics as well as just overall legislation and committee. Next slide. So we wanted to share with you a quick overview of the session as well as some of the objectives. We're going to be sharing with you some of the pertinent issues that are actually pending at the moment in Springfield and how they impact free and charitable clinics in Illinois, as well as the patients that you all serve. The session is designed to both engage you as well as increase awareness around these issues. I won't read all the objectives, but just know that, again, we're hoping that each of you is engaged, as well as that you walk away with some valuable information, as well as take action related to some of these updates. Next slide. Now I'm going to go ahead and turn it over to Lolita, who's going to start the presentation when it comes to some of our updates. Thank you.
Thank you, Luvia, and thank you, Melissa. Sorry, I was muted and I forgot to hit the unmute. So basically, I'm going to summarize what we did last year at the Illinois Association of Free and Charitable Clinics Advocacy and Policy Committee. One of the things that the association did was meet the legislators and educate them about this act, what this act is all about, and why it needs to be amended for recruiting volunteer physicians or what have you, the challenges that we face in the free health clinic sector, and how we can empower ourselves. Last August, The association also celebrated Free and Charitable Clinics Month. Despite the COVID-19 pandemic, Melissa again was a champion. She was able to coordinate this event, and Representative Teresa Ma participated in this, and the clinics discussed the various, again, challenges that COVID brought, along with the usual problems that are there with our sector, and then how we could respond to our patients. Then the third thing that this committee also did was address some of the barriers in vaccine distribution. The association, again, educated the governor's office and also the Illinois Department of Public Health on the challenges that the sector has and how we can help them in vaccine distribution. We also informed the member clinics about how to register in the iCares to receive the vaccines. And if they're not able to do so, then how to network with the federally qualified healthcare clinics and the local health departments to get vaccines for their patients. The last one that this committee did was Illinois Drug Reuse Opportunity Program. Levi, do you want to take over?
Okay.
Next slide.
Yeah. No. Hi. I figure like we'll go with HB 3232, and then I'll talk about iDrop after you're done.
Okay. So one of the other, moving on, the committee also, advocated for the Hospital Transparency and Accountability Bill. This actually strengthens the continuity of care from the clinic to the hospital for non-emergent medical treatment. And then the Illinois Drug Repository Program, and Levi is going to talk about this in detail later on. What this bill does is it enables Illinois to join the 38 states with laws that allow prescription medication redistribution programs. Next slide.
Okay, yes, I'll start.
Next slide.
No, and I'll talk to you about iDrop. Originally, it was called the Illinois Prescription Drug Repository Program, but we changed it to Illinois Drug Reuse Opportunity Program because that spells iDrop, and it's just a little catchy. And believe it or not, having a catchy name works and helps a lot of times in Springfield. This is not a new concept at all. Entities have been trying to pass this in Springfield for about 9 years. One of the biggest champions was former state Senator Patty Belloc. So I got involved with this about 4 years ago and made an initial run, and wasn't successful. But the way Springfield works a lot is that you kind of like do a test balloon just to see what the support is, who the opponents are. And so now I'll say that we're really ready to hopefully get this passed. So just to give you a little breakdown, which a lot of you already know. Right now in Illinois, it is illegal to donate unused prescription drugs, even if they're sealed or in tamper-evident packaging. iDrop will change that. And we're looking at donations that can be made by individuals, but also in terms of just size, that they'll come from institutions like nursing homes, palliative care centers, and the like. So if you go to the next slide, please. Okay. Essentially what we're trying to do is we're trying to go from gray to orange. Right now, Illinois is one of the few states that has no repository program in place. The yellows are the states where there is a act in place, but the program is not active. So we want to go to orange. Orange would mean that there is a program on the books in law in that state, and that there is an operative program there. Next slide. Okay, part of the strategy to get this done, and actually what I'm going to try to do is kind of use iDrop as an example to show you a little bit about how the sausage is made in Springfield. So one of the first things you need to do is like, okay, we need partners, we need a team, and we have we've been able to construct just an incredible coalition of partners. You'll see who's Cancer Action Network, the Illinois Pharmacists Association, Illinois State Medical Society, and very prominently IAFCC, and also even the Illinois Environmental Council, which was actually a very important partner to get, because a lot of times these repository programs are passed not because of the benefits to patients, but they're passed because of the impact that they have in protecting the environment. Next slide. Okay, if it passes, if iDrop passes, what will happen? Now, this is a scenario, but not the scenario. There are many options. So when I first became involved with this, I contacted a not-for-profit in Silicon Valley called Serum. And so right now, Serum probably operates more repository programs than any other organization in the nation. So the way this would work is that, okay, let's say a palliative care or a nursing home has heart medication or pain medication or insulin that they would like to donate. So Serum would actually pick that up, pick those unused, unopened prescription drugs up. Then a clinic like your clinic that you work at would be on the same computer platform. It's a software platform that they've developed that you say, okay, you know what, we need X units of this heart medication. So then you would essentially put in a request to Serum, and then that would be donated to you, and Serum would deliver it. So that is one scenario. There are others where it can come from different sources, but what we're looking at and how we're trying to sell it to the General Assembly is that if passed, then an entity like Serum or others would open up operations in Illinois and be able to help the patients that you serve. Next slide. Okay, here's where we get into a little bit of how stuff works. The bills that you would follow as IAFCC members would be in one of these committees. So in the House, you can see that there are 5 committees. And a little insight, it really doesn't make sense as to what committee to go to, because the committee that iDrop, the sponsor of iDrop in the House is Representative Will Guzzardi. Will was actually the chairman of the Prescription Drug Affordability Committee, but it went to the Human Services Committee. So give you a little history of how that went real quick. There were 15 members of that committee, and we had, out of the 15 members, 14 members of that committee were either the primary sponsor, chief co-sponsor, or co-sponsor. So with those 14, and we converted the last person, it swept. It went 15-0. So that allowed us to be on this thing called a consent agenda, which means that it's going to be lumped in with a lot of House bills that also passed unanimously. And also need to add to that, we had over 200 witness slips supporting us in that committee. So possibly we think tomorrow that it's going to be voted on by the full House as a part of the consent agenda. And just a little numbers in, it takes 60 votes to pass for a bill to pass the House. Now let's go to the Senate. Okay, in terms of timing, like I said, we weren't quite sure what committee we were going to go to. We ended up going to the Senate Health Committee, which we thought was going to be heard last week. Well, that didn't happen, so it was extended. Then we thought it was going to be alone. Then we thought it was going to be in another committee. So now at 3:45 p.m. today, that bill, the Senate version of the bill, is going to be in the Public Health Senate Subcommittee. and we expect at 3:45 it's going to fly through. Then it's going to go to the Senate Health Committee, of which of the 16 people that are on that committee, we have 9 people who are co-sponsors of the bill. So we feel really good about that. And also, when you're trying to do this stuff, you want to make sure that you also have um, a mix of Republicans and Democrats, and ideally people who are in leadership in the in the Democratic Party and the Republican Party, and we've been successful on both. Next slide. Okay, this is, if you want to look up a bill, okay, this is what you would go to. This is the homepage of the Illinois General Assembly's website, ilga.gov. So you can see that you can look at history of bills and resolutions. You can look at members of both chambers, the schedules, committees, transcripts. But let's say if you want to find out about House Bill 3232. So if you look over to your left where it says session schedule and go down, it says by number. You would type in HB 3232 and hit go, and this is what you'll see. Next slide. Okay, this is the bill status for HB 3232. I did it a few days ago, but if you go to this, you'll get to see full text of the bill, votes, witness slips. You also get to see who the sponsors are. You get to see if it was amended. You'll also see what the last action was. And next slide. This is just a continuation of that same bill status, but you'll see a synopsis of the bill, and then you'll see the actions where it's like first reading, picks up a new co-sponsor, and the like. So if there's a bill you're following, you can go to ilga.gov. As long as you know what the bill number is, you can track it. Next slide. Okay, this is a little scenario. Right now, we're looking at, and the way it sounds too, from an email Melissa posted, it sounds like the Senate Bill 1840 and iDrop are going to be in this committee for a vote of the committee at 4 o'clock today. So this is what a committee looks like. See the chair, vice chair. There's a minority spokesperson. That's always a person from the minority party who is prominent in that committee. And you'll see there are members, hearings, bills. Next slide. Okay, this is where things get interesting. Okay, witness slips in a hearing. So let's say this is for the hearing that occurred last week, what we thought was a hearing. Well, thanks to a number of you, we had 171 proponents who provided witness slips. It was just tremendous. It was no other bill had more than, I want to say 30. So we actually had an overwhelming presence. But if you go to this section, you'll be able to actually scroll down, see the bill that you want to follow. Let's say it was HB 3232. You get to see who has provided a witness slip, and then also you can do a witness slip if the timing is right for it. So next slide. Okay, that is it from me. I'll be available for Q&A, and thanks for your time. Thanks for letting me speak this afternoon. Appreciate it.
So, some of the next steps that the committee is looking at is advocating for, continued work, like meeting with your legislators, meeting the aldermen, and to continuously sensitize them on the needs of the free health and the charitable clinics. For example, our free health clinic run by the Indian American Medical Association, we had arranged a visit where Senator Staines had come and visited our clinic, and which actually benefited a lot. I believe she had a meeting with Representative Guzadi after that, and she had met with the trial lawyers in support of the Good Samaritan Act. Also, our clinic had met our local alderman and then the federal legislator, Mike Quigley. So this kind of sensitization and meeting and educating the legislators about our sector that that keeps the momentum that is already there. So, and then we encourage.
Oh, Lolita, I was going to add in too about that scenario. It was so important for iDrop with having former Senator Heather Steens at your clinic because, like you said, she arranged with Representative Guzzardi for the first sit-down meeting with the Illinois trial lawyers, who were the only opponents to iDrop. And so that meeting set up a second meeting where they eventually became neutral. So that visit, I'll put it this way: if that visit hadn't occurred, iDrop, we may not be in committee at 4 o'clock. So thank you.
That is so nice to hear. But in any case, we encourage all of you to join the Advocacy and Policy Committee. And the person to reach out is Melissa McGuire, whom you all know. And then please respond to the IAFCC updates and legislative calls to action, and then complete witness slips when there is a need to. Next slide.
Hi, Lolita and Levi. Thank you so much for sharing this important. And as we know about policy and advocacy, things happen quickly. I would like to invite Luvia to come back in and to see if before we go into questions, Luvia just got an email from Kathy Chen about the hospital transparency and accountability. And so I'm wondering if first Laura can go back to the slide that has the two different bills, and if Luvia can jump on the call. While we had a great update on iDrop and we weren't sure what was happening with the other legislation that we're supporting, Luvia is going to join and talk a bit about, you have the House bill number and the Senate bill number.
Great, thank you, Melissa. So as you just heard from Lolita and Levi, one of the bills that IAFCC is supporting is HB 3232, SB 1840. As Levi alluded to, SB 1840 is going to be heard today at 4 o'clock, so pretty soon, along with iDrop as well, so same committee. We just got an email saying that they are asking for witness slips, mainly saying that you support this. So I just put a link on the chat box. Hopefully everybody received it. In addition to what this slide says of what SB 1840 is, I would just wanted to add a few quick things. The main thing that this bill does is, as many of you know, the majority of the hospitals in Illinois are not-for-profit, meaning they do not pay property taxes. In lieu of that, they're supposed to provide hospital financial assistance known as charity care to uninsured individuals, anyone that lives in Illinois regardless of immigration status. For those of you that may not know, the majority of hospitals provide little, very, very little charity care, literally less than 4% when you compare it to their revenue. So what this bill does is not only does it increase transparency around what each hospital is actually doing or not doing towards charity care, but from an uninsured perspective, I think the most important point of this bill is it allows uninsured individuals to apply for financial assistance before they actually receive a service. So how it works right now is somebody maybe ends up in the ER, they're uninsured, they get a bill for that service, and then they have to apply for charity care, in addition to recovering from whatever the health issue is. Versus now, let's say you have one of your patients at one of your clinics that they need something, they need an MRI or they need some kind of surgery. Well, now with this bill, assuming that it moves forward and it becomes law, now your patient would have a right to go to a hospital that you refer them to and apply for this financial assistance beforehand. We know that one of the biggest fears and issues with uninsured is they do not want to get stuck with a high hospital bill. And that's what prevents many of them from seeking health services. So just really quickly wanted to elaborate a little bit on that bill, and then also to encourage everyone to submit a witness slip. It's pretty easy. You just click on the link, you put in your information, and then when it's asking about proponent or opponent, you put proponent with a P, meaning that you support the bill. Thank you.
Thanks, Luvia.
Thank you. If we can go back to the last slide, we can go to questions and answers. So as you see, the way the IAFCC Advocacy and Policy Committee works is we actually have a metrics that we look at, and we look at the mission of IAFCC and strengthening free and charitable clinics, increasing the awareness of the sector. And when legislation comes our way, we present it to the committee to look at. And in some cases, it presented to the IAFCC board, and we present it also out to our members. As your executive director, I've been sending updates to you through our Google listserv about the different legislation that's coming in front of the committee, and looking at requests for supporting in that. So we, as a member-run organization, we are informed by our members, and then the committee does the action. And we also inform our members, and then the committee responds in kind. So having a committee guide us is critically important. I'd love to open it up for any, should we put the link in the, Luvia put the link in the chat right now of where you would go to submit a witness slip. And the benefit to doing that is when you submit the witness slip, if you can submit IAFCC in your name, it shows that you're a member of the state association. It's not required, but there is an opportunity when you put your name in there that you would put -IAFCC or Illinois Association of Free and Charitable Clinics. So that's, so that would be the next step for that bill.
Alyssa, I was going to add to that. Well, by doing that, we were asked, could we show at one point, could we show more organizations? And that was perfect, because you could see in the night ministry -IAFCC, and just like it was kind of funny. Some of the members of the House committee was like, okay, there are like a lot of these IAFCC people. It's like, yeah, they will be direct beneficiaries of this if we pass it. So that was great. Oh, and I want to be able to tell my story too, of Exhibit A of how an IAFCC member really helps. When we were trying to get I dropped through the House Human Services Committee, we need to get a majority of 15, a simple majority, but we were stuck. And so we needed one more person to be able to go to the top. Well, in one of our calls, Suzanne Hoban said, oh, Stephanie, this is one of your targets? I got it. Sure enough, the very next day, we looked up on the bill status, and there was Stephanie Ness co-sponsor. So that was I've been using that example for a couple of weeks. That was a perfect example of how clinics can help pass legislation.
Right. Exactly. So having that relationship is really, really important and beneficial. The other way that it benefits is it increases the awareness of our sector. So Representative Gazzardi, whom I've not worked with, but he's on the group that submitted this legislation. When it was in the committee in the House, and then after it passed in the House, I immediately sent an email to Representative Gazzardi, and I just said, thank you for leading this, and we appreciate all you've done. And he replied immediately to my email, thank you for the great work of the free and charitable clinics. Let me know how I can help you more in the future. So I think while ideally we're looking at widespread support for our clinics, we're looking at ways to get resources and funding for clinics. This type of support and work is important in that it does provide resources to our clinics. And on the other hand, it also increases our awareness in our sector, where now we are being seen, because we don't want to be seen as, we are being seen as part of other legislation that supports, other than give us money for our sector, right? So when we are involved in things like these two very important pieces of legislation, it's all a piece of the puzzle of increasing the awareness of the great work that your clinics do. I'd like to see if there's any questions. I'm wondering if anybody else on the call can type in or share any experiences that you have had with meeting with your legislators that you have found for it to be beneficial. Because I think that's really key. It's a really important first step, is that you reach out to your legislators and either side of the aisle, and you continually inform them of the great work of your clinic. Because a lot of the times when I'm having conversations with them, the first thing I'm doing is educating, not as much now as it's been when I first started, but the first thing I'm doing is, what is a free and charitable clinic? The more you all do that with your legislators, then IAFCC's message can be about the statewide support of our free and charitable clinics. So if any of you have had legislator visits or contacts, it would be helpful if you could type that in the chat so we can see how you've been reaching out to your legislators. Can I see? Oh, there we go. Oh, I think this is great. So Suzanne and Cara together, they were able to work together with Representative Underwood. So by continuously calling and keeping in contact with Congressman Lauren Underwood, she was invited to take part along with Cara Murphy on her Facebook presentation regarding the new stimulus bill. And I think that's critically important, being in front. And you heard Cara talking about who she reached out to, as well as doing her vaccine flu. And Suzanne is always in front of the legislators. Mark Davis reported that that they reach out on occasion to Bill Foster, their congressman, but it's been a while. So hopefully being able to update your legislators. Oh, I'm sorry, this is Sue Davis, I'm sorry, from Bolingbrook Christian Health Center. So by being able to be in front of your Congress people, men and women and people, about your clinic, it's critical. It's still very important now more than ever. Anybody else want to share? I think Mimi actually continues to advocate for the ARC, and with larger conversations as well. Any other sharings or lessons learned? Do you have any other questions for the IAFCC? So like the three big things, right? We're continuing to be in the dialogue about vaccine distribution, about vaccine referral. We continue to be in the conversation about hospital accountability and transparency for the uninsured and underinsured. We continue to be in the conversation for legislation that supports eye drop, which are unused, unexpired medication that could go directly to your clinics. Other comments from the panelists?
Melissa, you bring back a memory when you said share a story. It was very inspiring for me when we met Representative Ma 2 years ago when Luvia came and we all met. And during our conversation, she had mentioned that she used to volunteer at a free health clinic for 3.5 years. And so she knows all about our sector. when you hear a story like that, you're like, okay, half my battle is won. Our legislator knows, what we are talking about. So I just wanted to share that with the attendees.
I was just going to add about the significant change and how it is really important that you keep a constant dialogue with your elected officials, and that's elected officials in Springfield, that where you work and also where you live, because in just about 3 years, there has been a 1/3 turnover of the members of the General Assembly. Plus, there's essentially a governor who was only going through his 3rd session. Really, it's only his 2nd real session. And we have new leadership in the Illinois House, the Speaker of the House, which everybody's heard of, but also the President of the Senate, Don Harmon, has not been in his job that long too. And this session is sort of showing it, because last year, because of the pandemic, the session only lasted for about 4 days. We're seeing new rules, new procedures, and even shifts of like how legislators need to learn how to operate in this new environment. Plus, there's an opportunity, I think, in Springfield with all of these new legislators that you can be a sounding board, you can be a subject matter expert for them on a variety of topics. So, they are not experts on a lot of things that you do. So you can really be a resource for them. And that's an ideal relationship to have, that if they have a question that might relate to prescription drugs or some of the aspects of SB 1840, you're their expert.
Okay, so any other comments from our group? I would like to thank you all, and I'd love to hear any last comments from Luvia, Lalita, or Levi.
I think the only thing I would add, Melissa, is for those of you that maybe had not heard of the committee before, we invite you to get involved. We're a pretty friendly bunch, so we hope you consider it. We're happy to meet people wherever they are when it comes to their experience or knowledge, as well as their comfort level. As well as just reach out to Melissa if you are interested in joining. If anyone needs more information or wants more information on either legislation that Levi and Lalita talked to, feel free to reach out. Melissa does have fact sheets on both of them. And again, I know Suzanne is saying that witness slips are closed. I was told they were open, so I'll double check. And again, assuming that it does work okay, the link, please submit a witness slip. We are not expecting too much opposition, but as you heard from Levi, it's very important that the committee members hear from everyone.
Thank you so very much. So we're so proud of the committee and the great work that this committee, I think they're open. Witness slips are open. So the link that is in your chat is what would take you, and you are supporting that bill, very important bill. So that's great. So again, please join our committee. Please continue to see that we are continuing to increase our presence in Springfield due to the great work of Levi, Lalita, and Luvia. IAFCC is now starting to get contacted by legislators and or other policymakers saying, would you guys sign on to this? And this is exactly the place we want to be. We want to be able to see legislation, read it, get it out to our members, and then have an informed response to our members. And it's all because of the great work of this committee. So thank you all very, very much for everything you do.